Chronic kidney disease afflicts an estimated 8% of European population, a number that is increasing year by year, driven in part by the increasing prevalence of hypertension, diabetes, and aging. Peritoneal dialysis and hemodialysis are two relevant clinical treatments. Both have broadly similar outcomes, but only 10% of patients receive peritoneal dialysis, despite it is home-based, is substantially cheaper, and there is an early survival advantage for peritoneal dialysis. Improve PD is a European project precisely designed to encourage the use of peritoneal dialysis and to overcome the scientific and clinical barriers for its expansion. This project is funded by the European Union under the Marie Skłodowska-Curie program of the Horizon 2020 Framework Program. Improve PD Consortium is formed by 22 organizations representing 9 different countries in Europe and other regions. The project is coordinated by the Spanish Research Council, SESEC, in particular by the Severo Ochoa Molecular Biology Research Center, and has a duration of 4 years.
Improve PD project is about the identification and management of those people with chronic renal disease that are in higher risk to develop cardiovascular disease. And especially we will focus on the patients that are treated by peritoneal dialysis. And at the same time that we develop this project, we will train 15 early-stage researchers with the purpose to have in the future 15 highly trained, highly qualified, specialized people to lead the PD field in the future.
What are the aims of Work Package 1? In Work Package 1, we want to understand why some people on peritoneal dialysis have a low risk of developing complications, especially cardiovasculopathy, and other ones have a high risk. So we want to understand the PD treatment-related factors, the pharmacotherapy-related factors, genetics factors, and many other factors involved in developing cardiovasculopathy. And then we will also want to understand what are the molecular mechanisms driving these diseases, especially cardiovasculopathy, in these groups. And the third aim of the project is to validate the findings from Work Package 2 and 3 in human samples, so in blood, dialysate, but also in tissue, in abdominal tissue, that is the peritoneum, and in vessels from patients on peritoneal dialysis. So we will understand all these different contributions, and at the end we hope that we indeed can improve the outcome of people on peritoneal dialysis and better decide which patient should go on peritoneal dialysis, or rather better goes on hemodialysis.
Improve PD will organize 7 international training events across Europe to train early-stage researchers. These events will also serve as vehicles for discussion among clinicians, researchers, and stakeholders.
We have the leading laboratories in this field connected in this consortium, so I think that the scientific discoveries that we can make will be strong. One of the other big opportunities here is that there's been recent evidence that inflammation is so important in cardiovascular disease in general. We have a real opportunity here to show the importance and the understanding of the mechanisms of that in people who are treated with peritoneal dialysis. And the key thing there is that these are people who are at very high risk of cardiovascular disease, and also people in whom we have the ability to access directly the tissue, the peritoneal cavity affected by the condition. So we have the opportunity to study mechanisms, particularly of inflammation and immunity, directly in the tissue, and increase our understanding of the pathology of cardiovascular disease and inflammation. I hope then that we will be able to take that understanding and move it through to new treatments and new therapies for patients and people more widely.
So in this project we have the very nice structure of 3 work packages: identifying, understanding and treating patients. And in this 3rd work package, Treat, it's really all about transforming the mechanistic insight from the other work packages into new treatment for people who are treated with peritoneal dialysis, which means new solutions for PD treatment, but also new clinical trial designs, or trying to replace some of the limiting factors in the therapy with new components and finding better treatment options for these people that are treated with peritoneal dialysis.
Improve PD will implement 15 research projects from basic to clinical and industrial research. All of them will collaborate to achieve the goals of Improve PD project.
So we will of course be presenting our research findings at important clinical meetings, for example the EuroPD meetings. We've been working for a long time in partnership with EuroPD, who's been running important meetings for PD experts in Europe for at least 30 years. We will also be publishing our outcomes in high-quality peer-reviewed journals. But also, in addition to these important ways of disseminating research, we are very keen that we enable people who are treated with peritoneal dialysis to understand our research. So each of our early career researchers will be preparing outputs for clear understanding of research by the general public and people who are requiring dialysis treatment.
Improve PD is open to the participation of third organizations from any country, from any clinical, research and industry sector, as well as any networks and stakeholders worldwide. Let's work together for the quality of life of our future generations.